welcome back. Now, Namibia participated in the 76th World Health Assembly that took place from the 21st to the 30th of May in Geneva, Switzerland. The assembly is an annual gathering graced by all 194 member states of the WHO. The delegation comprised of officials from the Ministry of Health and Social Services, the Permanent Mission of Namibia to the United Nations Office, led by the Minister of Health, Kalumbi Shangula. Joining us to shed more light is Mr. Nangombe, the Executive Director in the Ministry of Health and Social Services. Mr. Nangombe, good evening and thank you for joining us here on the Daily Roundup.
Good evening, Nina. How are you?
I'm good, thank you, sir. How are you this evening?
I'm doing very well. Thank you very much for coming to us to talk about Namibia's participation in the 76th World Health Assembly.
And perhaps you can start by telling us what the focus was of the 76th World Health Assembly.
Yes, the 76th World Health Assembly was held under a theme which was dedicated to commemorate the 76th anniversary of the founding of the World Health Organization. This theme was stated as saving lives, driving health for all. Basically, the theme aims to call for a new drive in order to achieve health equity so as not to leave anyone behind. This is a concept which is in line with the WHO principles, which states that health is one of the fundamental rights of human beings, regardless of race, region, political beliefs, economic or social condition. So that was the main focus of WHA 76.
And what was Namibia's contribution to the Assembly?
Perhaps before we get to the participation of Namibia in the Health Assembly, let me just add that as the Assembly focused on the theme, this theme is also looking at the triple billion targets of the WHO. And these triple billion targets are being implemented by the WHO under 3 pillars. And pillar 1 is to ensure that 1 billion more people benefit from universal health coverage. Pillar 2, 1 billion more people are better protected from health emergencies. And pillar 3, 1 billion more people enjoy better health and well-being. So that forms part and parcel of the focus of World Health Assembly 76 we just ended. And coming to Namibia's contribution to the Assembly, as indicated, we have been participating quite for a number of years. Namibia is a small country. We are quite respected in terms of the inputs that we make to the discussions and the negotiations that are ongoing at the Health Assembly. So in this year, as a member state, we participated in discussions on roughly 27 agenda items that were discussed at the Assembly. There were more than that, but we focused, because we had to choose. Our delegation is not so big to attend all the agenda items that are taking place, but we had to focus on those that we feel are best suited for our national interest. So, for example, we advocated for sustainable financing of the WHO, including voicing support for an increase in assessed member state contributions to cover at least 50% of the WHO's program budget. This is because we feel that it is necessary to achieve the financial independence of WHO in order to increase the overall efficiency of the organization, so that the organization does not heavily depend on donors who may have fixed priorities, which may also not be in line with the priorities of the WHO. Other contributions that Namibia made include our reporting as a...
Sir, you were still elaborating on your point there, but just for the sake of time, perhaps you can just briefly summarize for us.
Yeah, no, you were asking about Namibia's contributions in the Health Assembly. And as I indicated, we spoke about the question of the funding and financing for WHO. And we also made contributions regarding our own progress at national level, including our enactment, or rather the drafting of the Food Safety Bill, which seeks to regulate and provide for food quality assurance, and the reduction of salt intake, the control of sugary and fizzy drinks, and the reduction of trans fats in food. This is important because we are, of course, looking at the issues of non-communicable diseases that are caused by some of these agents. So that is one of the issues that we reported on as part of our participation in the Health Assembly.
Mr. Nangombe,
in terms of, yes.
perhaps you can just talk to us about how Namibia is faring towards achieving its, health goals aimed towards 2030, because that was also a focus of the Assembly in terms of how far we are from our target, which is the year 2030.
I think when one looks at the targets towards 2030, which also is the date for achieving universal health coverage, Namibia has done fairly well, also in terms of the sustainable development goals. And this is because we have, for example, put in place a public health system that provides essential health care services to all our people. We were, for example, this year reviewing our essential health services package to look at the kind of services that must be available at every level of healthcare services, whether it's a clinic, whether it is a health center, whether it's a district hospital or a referral hospital. And when we look at specific programs, for example, the HIV/AIDS pandemic, Namibia has done fairly well. And as we reported earlier this year, we were given an award for having achieved the targets on the 95, 95, 95 cascade, where Namibia now stands at 92, 99, 94. So we are also, in terms of the global ranking for the achievement of universal health coverage, Namibia is actually ranked at about 70% in terms of moving towards universal health coverage. And this is because our cabinet has, for example, approved the policy framework for universal health coverage. We are conducting ongoing public consultations with various stakeholders, with businesses, for example, with faith-based organizations, non-governmental organizations, members of parliament, etc., etc. So we are doing fairly well in terms of what we have done. As we know, more than 85% of Namibians depend on public healthcare services provided by the state, and we have health facilities that are established all over the country, and this is where we've got.
Mr. Nangombe, unfortunately, we're out of time, but thank you once again for your time and joining us this evening on the Daily Roundup.
You're most welcome.
That was the Executive Director in the Ministry of Health, Mr. Ben Nangombe, speaking to us.